Yeah, well, I guess it's probably a good time to talk about the process. So when we have someone who might be interested in Ortho-K, or we're introducing to someone who's a potential candidate, we're looking at, first of all, what's their prescription like. We do use a topographer, which maps the eye shape. So we're getting a sense of their suitability to the treatment. We're obviously going to be talking to them about their goals and what their expectations are, and making sure those sorts of things match. Being a contact lens, we talk about hygiene and managing infection risk. So once we get past that stage, then we do a fitting process. So it is a custom made lens. So we use some lenses that we call trial lenses to match the information we're getting from our instruments to the actual eye. That also allows the person to get some experience. Now, a lot of the time, the trial lenses that we're using, that they get to use sort of overnight, can be fairly closely matched to the final lens that you're going to get. So, if we fast forward to when you've actually got your actual lens, you're looking at sort of 50 to 70% of your prescription out on the first night. The research done some time ago sort of indicated that across different designs of Ortho-K, you were looking at sort of hitting your maximum daytime vision on average by 2 weeks. And I certainly think that clinically we're seeing that, since that research has been done, more efficient strategies. I feel like we're sort of seeing that more like by the end of the week, you're getting good daytime vision. It might be little things like about your night vision that we're still troubleshooting. And so there's a little bit of a fitting process to initially order the lens. So it might be a couple of weeks of trialing. But once you've actually got your lenses, then you're talking a week or two and you're on your way. Bearing that some cases we might have to fine tune the lens and the fit, but typically you're seeing well enough in that time that for the majority of people, it's just fine tuning.
And so, like, I've got personal experience only with soft contact lenses, but Ortho-K lenses are the rigid variety, aren't they? So does it
Correct. And
take
that, that
does it take people a while to sort of adjust to that sensation?
Yeah, absolutely. So you feel it a bit more on your eyelid. Back when rigid lenses were mostly used for daytime wear, I remember one of my and prior, some of the earlier versions of soft lenses not being the healthiest things around. It was, one of my mentors used to quip that hard lenses were hard on you mentally in the first couple of days, but soft on your eyes, because we had very low complication rates with daytime hard lenses. Whereas soft lenses were soft on you mentally, but hard on the long term on your eyes. And so, yes, there's a little bit of eyelid awareness, but again, most of that comes from the eyelid moving over the lens. And so I say to people, look, put your lens on, close your eye. What should happen is most of the sensation should go away. It's not going to keep you awake. And once you've worn them a few times in a row, that sensation gets less and less and less. And when I do a review with my long-term Ortho-K wearers, and even some of the ones in the short termers, what do you notice about them? Oh, they're fine. They don't bother them. They're not bothered by the sleeping. Some people can read for a little, sort of half an hour or so while I've got them in before they nod off. So it's a very short-term issue.
How do they actually compare in size with like old school rigid lenses? Are
Yeah,
Ortho-K lenses the same size, or are they a little bit bigger? Or what's the difference there?
typically a little bit bigger. So if you look at soft lenses, are typically around the 14 millimeter diameter. Traditional rigid lenses daytimes were probably more like 9 millimeters. Um, I would probably, in a rare instance, fit a 10 millimeter Ortho-K lens, but most of them are going to be sort of 10.5 to 11.5 millimeters in size. So they cover pretty much the cornea, sits over your iris. And so if you look at the visible iris color, most people fit within about 11 to 12 mils, and the Ortho-K lens fills that cornea effectively, and which makes them a little bit more comfortable than traditional rigid lenses because they don't move as much.
Well, another type of like special contact lenses is scleral lenses, which fit over the whole cornea. And I
Yes,
think with scleral lenses, a lot of people use special tools maybe to insert or remove it. Is anything like
absolutely.
that? Is anything like that required for Ortho-K, or you can pretty much just do it with your fingers?
But where I can, I do prefer people just use their hands to take Ortho-K lenses on and off, put them on and take them off. At least initially, it can be a little daunting, or if some of the finer motor skills are a little bit more challenging, we might use a little suction device for removal. It's just another thing to keep clean and look after and replace. So at some stage, my preference is to be able to teach them how to take them off without doing that.
And what's the cleaning and maintenance process at night? Like how long would that take, and like what do people need to do with their lenses to keep them
Yeah,
healthy,
so
to keep
you
them in
do
good
need to
shape?
use what we call a soaking solution. So after you've worn the lens, so the process I say to people, you wash your hands, take the lens out. You're going to use a solution that you rub it in. So you're going to gently rub the lens for about 20 seconds each, 20 to 30 seconds each side. You're going to rinse that off, and then you're going to pop them in a case with a soaking solution, which has a low concentration of a disinfecting chemical effectively that works across the day to clean the lenses. That evening, you're going to wash your hands, you're going to take them out of the case, you're going to tip that solution out, you're going to rinse it with a sterile saline. And in my practice, we use that same sterile saline to put in the back of the lens to put on in front of your eye. So you've got that cushion of a comfortable liquid that goes on with the lens. And then we get them to do a protein clean once a week, which is an intensive clean.
Okay.
Because these are a lens that you're not replacing. It's not like a daily soft lens where we're getting a new lens each day. This is a lens that you're having to hang on to for 12 months up to 2 years.
Okay, well, that's a really good segue to my next question, which is about the cost comparison of Ortho-K to maybe other solutions like daily disposables. So, like in general terms, like what could people expect to pay
It's
on
probably a
this?
little bit more, it's more upfront than wearing regular contact lenses, but if you kind of space it out over, a sort of 2 to 4 year period, you're probably fairly even Steven by the time you look at, particularly if you're comparing it to single use or one day lenses, the most common now. And if you're using a high quality single use brand, then you are easily spending the same sort of money, if not more than what you would be with an Ortho-K lens over the longer term.
And do you think people need to have a backup pair of Ortho-Ks, or is it generally if people just have the one pair?
I guess because just that upfront cost, look, if you're traveling a lot, I do suggest that's a good idea. You can often get away with a backup using glasses, and some people do soft contact lenses, depending on their tolerance of the soft contact lens. So there's a number of different ways you can sort of do a backup, but certainly if you're traveling or you'd be lost without it, then a second pair is not a bad idea.
And with Ortho-K, do you check that people's prescription is pretty stable before you fit them with a pair, or is that really not an issue in the same way that it could be like with LASIK, for example?
Yeah, look, and it's kind of one of the requirements of laser surgery is that you've got at least 12 months of stability before you're considered a candidate. And with Ortho-K, I mean, we're using it to create stability and try and slow down those changes. So it's absolutely not a reason. In fact, if someone is progressing in the myopia, that would be a stronger argument for using some sort of myopia control. And as we've discussed earlier, Ortho-K fits perfectly into that. So that would be a big green light to kind of really consider this as an option.